What workplace investigation revealed something way darker than you expected? The file folder slipped from my hands and patient charts scattered across the floor. I knelt to gather them and froze. Patient names with dollar amounts. The word recruitment circled in red ink. Warren Kemp's handwriting. I pulled out my phone and photographed every page. Footsteps echoed from the hallway. I shoved the papers back into the folder and jammed it behind the other files exactly where it had been. The footsteps passed, then left through the back stairwell. Then I sat in my car staring at the photos. This wasn't billing fraud. This was something else entirely. Milo Reeves had walked into my treatment room weeks earlier, barely able to lift his arm. 6 weeks post-rotator cuff surgery, and he should have been progressing. He'd been doing excellent through the first month. Now he couldn't reach shoulder height. I asked what changed. Nothing. No re-injury, no missed exercises, no medication changes. I checked his chart 3 times. Same patient. His pain jumped from a 3 to an 8 with no explanation. I told him I'd consult with Dr. Iris Hartley. After he left, I found Caleb Moran in the break room and mentioned it. He asked if I'd seen other patients regress unexpectedly. I said no. He walked out without another word. Tessa Vaughn came in 3 weeks later, needing her husband to support her just to walk. Spinal fusion patient who'd been independent the week before. Her pain spiked to post-surgery levels. Her husband asked what we'd done to her. I had no answer. I pulled every file I'd worked on for 4 months and found 7 cases. Normal progress, then sudden regression. I made a spreadsheet. Every regression led to months of additional treatment, double or triple the normal appointments. The billing numbers showed it clearly. A typical recovery ran 3 months with 12 appointments. These patients were still coming in at 8 or 9 months. I showed Caleb the next morning. He stared at the spreadsheet for a long time before speaking. He told me he'd noticed it 2 months ago and mentioned it to Dr. Hartley in a staff meeting. She'd dismissed it immediately. Then she'd called him into her office privately and told him questioning outcomes was questioning her leadership. He'd dropped it because he couldn't lose his job. 2 kids in private school, mortgage, the usual reasons people stay quiet. I spent the rest of that week pulling files from other therapists without telling anyone what I was doing. Same pattern across the entire center. Patients improving, then suddenly getting worse. Treatment stretching from 3 months to 8 or 9. The revenue increase was massive and consistent. I pulled billing records and compared them to treatment notes. The discrepancies were everywhere once I knew to look. Patients being billed for services their progress notes didn't support. Treatment codes that didn't match documented procedures. Dr. Hartley called an all-staff meeting that Friday. She announced new documentation requirements. Every patient assessment would now be reviewed by her personally before being finalized in the system. Any concerns about unexpected patient outcomes had to be reported to her directly before being discussed with colleagues or documented officially. She called it quality control and ensuring consistency in patient care. I watched Caleb stare at his hands the entire meeting. After it ended, Yasmin Fletcher from billing caught me in the hallway. She glanced around, then pulled me into an empty treatment room and closed the door. She said she'd been bothered for months about the billing practices at the center. Patients who should have been discharged weeks ago were still being scheduled for appointments. She'd flagged several cases to Dr. Hartley, where the treatment codes didn't match what she was seeing in the progress notes. Dr. Hartley had told her to process the claims as written and stop questioning clinical decisions. Yasmin's hands shook as she talked. She made me promise not to reveal where I'd heard this. I promised. She left through the door first, and I waited 5 minutes before following. That weekend, I couldn't stop thinking about those patients, the ones who'd gotten worse under our care without understanding why. I requested a meeting with Dr. Hartley to discuss patient care protocols. She made time for me. I sat across from her desk and mentioned noticing some patients experiencing unexpected setbacks. I wondered if we should review our treatment approaches. She said patient outcomes vary widely based on factors we can't always control. Good therapists understand recovery isn't predictable. I pushed a little harder and mentioned specific cases. She leaned forward and asked if I was suggesting there was something wrong with how the center operated. I tried to backtrack and frame it as curiosity about improving outcomes. She cut me off. She said she'd built this center's reputation on excellence and wouldn't tolerate staff members creating doubt about our methods. She reminded me that physical therapy is a competitive field, and therapists who develop reputations for questioning their employers find it difficult to get hired elsewhere. The threat was delivered with a smile, but it landed hard. I left her office knowing I'd just made myself a target. An attorney named Arthur Coslow called that evening asking if I was the therapist treating Milo Reeves. I confirmed I was and asked who was calling. He identified himself as an attorney representing Milo in a potential medical malpractice claim. Milo's surgeon had reviewed his current condition and found it medically inconsistent with the progress documented in his therapy records. The surgeon suspected either negligent care or intentional interference with his recovery. Arthur wanted to know if I'd be willing to provide testimony about Milo's treatment. I told him I needed time to think about it and ended the call. I called Caleb that night and told him about the attorney's call. He was quiet for a long time before saying he'd received a similar call 3 weeks ago from a different lawyer representing one of his regressed patients. He declined to participate because he couldn't afford to lose his job or get blacklisted in the medical community. If we were being honest, the only explanation that made sense was that someone was deliberately sabotaging patient recovery to extend treatment and maximize billing. Dr. Hartley told me the next morning she was adjusting my caseload. Several of my current patients would be transferred to other therapists, and I'd be taking on new patients who were earlier in their recovery. She was removing me from the patients who'd experienced regressions, eliminating my direct knowledge of their ongoing care. I spent that day documenting everything I could about my current patients before the transfers took effect. I secretly photographed progress notes and billing records when no one was around. I was treating a new patient named Reggie Cross when I noticed his prescription medication list in his chart. He was 3 weeks post-ACL reconstruction and progressing normally through his exercises. There was a notation I didn't recognize in the medication section of our file. It looked like someone had added a secondary entry that didn't match the surgeon's orders. I pulled up his full medical record in our system and found discrepancies between what his surgeon had prescribed and what was documented in our internal notes. The modifications would have the effect of reducing his pain medication dosage while increasing anti-inflammatory medications that could mask pain without actually promoting healing. I went back through the records of the patients who'd regressed and checked their medication documentation. Every single one showed similar modifications to their prescribed protocols. Someone with system access had been altering medication instructions in ways that would slow recovery or even cause regression while appearing legitimate in our documentation. The changes were subtle enough that patients wouldn't necessarily notice unless they compared our instructions directly with their surgeon's orders. Most patients assume their physical therapy center is coordinating with their surgeon, so they follow whatever instructions we give them. I took screenshots of the evidence because this wasn't just billing fraud anymore. This was deliberate medical sabotage that was causing real physical harm to people who trusted us. The system's edit logs showed every alteration had been made by someone with administrative access, and the timestamp patterns showed they were usually entered late at night or early morning when the office was empty. Dr. Hartley, Warren Kemp, our nurse practitioner, and Claudia Yoshida, the assistant, all had administrative access. I met Arthur Koslow at a coffee shop in Bellevue that weekend. I brought printed copies of everything I'd found with patient names redacted. Arthur sat across from me reviewing the documents with increasing tension in his jaw. When he finished, he looked up and said what I was showing him went far beyond malpractice. This was systematic patient harm for financial gain, potentially fraud and assault charges. He explained that if I went public with this evidence, I'd need protection from retaliation and probably an attorney of my own. He gave me the name of an employment lawyer who handled whistleblower cases and told me to call her before doing anything else. He also said Garrett's case now looked completely different and he'd be expanding his investigation based on what I'd shared. I called the employment attorney Carolyn Pierce the next morning. She specialized in medical whistleblower protection. I explained the situation in her office downtown, showing her all the documentation I'd gathered. She listened carefully and asked detailed questions about the timeline and who knew about my investigation. When I finished, she told me Washington State had strong whistleblower protections, but enforcing them required following specific procedures. She needed to send a formal notification to the center's management and ownership outlining my concerns and demanding investigation. This would legally protect me from retaliation, but would also immediately alert everyone that I was the source. She was honest that my working environment was about to become hostile regardless of what legal protections existed. I signed the paperwork authorizing her to proceed because I couldn't live with staying silent anymore. The letter arrived at the center days later. I wasn't there when Dr. Hartley received it, but Caleb called me before my afternoon shift started to warn me. He said Dr. Hartley had called an emergency management meeting, and the entire administrative team was behind closed doors. The atmosphere in the office was tense, and everyone was speculating about what was happening. He told me to be careful when I came in, because whatever was about to happen wouldn't be good. Dr. Hartley was waiting in my treatment room when I arrived. Her professional smile was completely gone, replaced by barely controlled fury. She told me I'd made a serious mistake sending legal threats based on unsubstantiated concerns. She said I'd violated patient confidentiality, exceeded my professional authority, and damaged the center's reputation. She handed me a formal written warning citing multiple policy violations and told me I was being placed on immediate administrative leave pending investigation. I wasn't allowed to access patient records or discuss the situation with other staff members. Security would escort me out of the building immediately. I asked if I could get my personal belongings from my locker, and she said they'd be mailed to me after being inventoried. The security guard looked uncomfortable as he walked me through the lobby past my colleagues, but he did his job. I saw the looks on their faces as I was escorted out. Some looked confused, others looked away. Carolyn called me that evening and said the center's response was exactly what she'd expected. They were trying to isolate me and build a case for termination based on policy violations rather than whistleblowing. She'd already filed a complaint with the Washington State Department of Health outlining the medication tampering evidence and requesting immediate investigation. She'd also contacted the FBI's Healthcare Fraud Division because the insurance billing patterns suggested organized fraud. Carolyn warned me the investigation would take months and my life was going to be difficult during that time. She said most whistleblowers underestimate the emotional toll of fighting institutions with resources and legal teams. I needed to prepare for my name being attacked, my professional competence questioned, and possibly facing financial hardship if the case dragged on longer than my savings could sustain. The Department of Health investigator called me 3 days later. Her name was Denise Landry, and she'd been reviewing the evidence I'd submitted through Carolyn. She wanted to meet in person to walk through everything in detail. We met at her office in Olympia. Denise took me through each case systematically, asking questions about the medication documentation, the billing patterns, and what I knew about who had administrative access to make the changes. I told her everything I'd discovered, including my suspicions about Dr. Hartley, Claudia, and Warren. Denise said they'd be conducting a full audit of the center's practices and patient records, but she needed me to understand that proving intentional harm versus negligent documentation was difficult and time-consuming. A journalist named Zara Kovac called 2 weeks into my administrative leave. She identified herself as an investigative journalist working on a story about physical therapy billing fraud. She'd heard about the Riverside investigation through her law enforcement sources and wanted to interview me. I told her I couldn't discuss an ongoing investigation, and she said she understood, but asked me to think about it. She said these stories rarely get public attention unless someone with direct knowledge is willing to speak on record, and without public pressure, regulatory investigations often result in quiet settlements that don't prevent the same thing from happening elsewhere. She gave me her email and said to reach out if I changed my mind. Carolyn called the following week with news I wasn't expecting. The FBI investigation had uncovered something much larger than insurance fraud. They'd traced the medication tampering pattern back 18 months and found it affected over 40 patients, not just the 11 I'd identified, but more significantly, they discovered that the medication modifications weren't random. The specific changes being made to pain medication protocols were consistent with practices used to create patient dependency on prescription opioids. Someone at the center had been systematically altering medication instructions in ways that increased patients' pain levels and made them more likely to seek additional pain medication prescriptions. The FBI believed they were looking at patient recruitment for an illegal prescription drug distribution network. I sat down hard when Carolyn told me this because what started as billing fraud had turned into something so much worse. These weren't just being overcharged, they were being deliberately harmed and turned into addicts. The evidence pointed to Warren Kemp as the primary actor. He was the only one with both administrative system access and prescription authority as a nurse practitioner. Further investigation revealed he had connections to a pharmacy in Tacoma that was already under DEA scrutiny for suspicious prescription patterns. Warren had been referring patients from the center to this specific pharmacy, claiming they offered better pricing on medications. Patients whose recovery was deliberately slowed became long-term pain medication users, and many of them got trapped in dependency cycles that required increasingly stronger prescriptions. Warren was getting kickbacks from the pharmacy for patient referrals, and the pharmacy was supplying a distribution network selling prescription opioids illegally. The scope of it made me physically sick because these were vulnerable people recovering from injuries and surgeries who trusted us completely. Dr. Hartley's culpability was still being investigated. The evidence suggested she knew about the billing irregularities and deliberately ignored them because they increased revenue, but it wasn't clear yet whether she knew about the opioid recruitment scheme. Carolyn explained that prosecuting medical professionals required absolutely bulletproof evidence. The FBI was building their case carefully. She said I should prepare for this becoming very public very soon, and I needed to decide whether I wanted to control my own narrative by speaking to media or let the story be told without my input. I called Zara Sterling that evening and agreed to an interview on the condition that she wouldn't publish until the FBI made arrests. She agreed immediately and came to Seattle the following week. We met at a hotel conference room she'd rented for privacy, and I spent 4 hours walking her through everything. She recorded the entire conversation and took pages of notes. She told me her investigation had uncovered 2 other physical therapy centers in California with similar patterns of unexplained patient regression and extended billing. She believed this was a broader scheme being replicated by people who'd learned they could exploit the trust patients place in their medical providers. The story she was writing would connect these dots and hopefully prevent other centers from attempting the same thing. That's when I decided to search the office myself. I needed to know for certain who was behind this, and I needed evidence that would be undeniable. I stayed late using the excuse that I wanted to pick up some personal items before my leave ended. The building emptied out by 9. I used my badge to access the medical records room and started pulling files. I photographed medication logs, billing records, and system access logs. I I'd been at it for over an hour when I reached for a file on the top shelf and knocked over an entire stack. Papers exploded across the floor, and I dropped to my knees to gather them before anyone heard. That's when I found Warren's handwritten notes on yellow legal pad paper, not official documentation, personal tracking, patient names with dollar amounts next to them, pharmacy addresses in Tacoma, referral numbers. The word recruitment circled 3 times in red ink. Notes about which patients were progressing to next phase and which ones needed additional intervention. I photographed every page with my phone, then carefully replaced everything exactly where it had been. The FBI raided the center on a Thursday morning at opening time, removing computers and files while staff and patients watched in confusion. Warren Kemp was arrested at his home before dawn. The pharmacy owner and 2 employees in Tacoma were arrested simultaneously. The news coverage started within hours, with local stations showing footage of the FBI leaving the center carrying boxes of evidence. My phone exploded with calls and texts from former colleagues wanting to know what was happening. Caleb called crying because he'd been treating patients there for 8 years and felt like his entire career was tainted by association. He said no one would understand that he didn't know what was happening, that he'd tried to speak up and been silenced. Dr. Hartley held a press conference that afternoon outside the center, flanked by her attorneys. She expressed shock and betrayal over Warren's actions, claiming she had no knowledge of any medication tampering or illegal activity. She portrayed herself as another victim who'd trusted an employee who betrayed that trust. She announced the center would be cooperating fully with investigators and implementing comprehensive reforms. Watching her performance on the news made me want to throw something at the screen. The Department of Health suspended the center's license 3 days later, pending the outcome of their investigation. Dr. Hartley tried to fight it in court, but a judge denied her emergency motion, stating that public safety concerns outweighed the business harm. The center closed its doors permanently the following week. Over 30 staff members lost their jobs immediately. Caleb called me in tears, saying he'd been applying to other facilities, but no one would interview him once they saw Riverside on his resume. The entire center had become toxic by association, even for people who'd had nothing to do with the fraud. I felt guilty even though I knew intellectually that I wasn't responsible for other people's unemployment. I'd exposed harm, not created it. The center's insurance company settled with Milo, Tessa, and 7 other patients within 3 months of Warren's arrest. The settlement amounts were confidential, but Arthur told me they were substantial enough to cover ongoing medical care and compensate for the harm done. Several patients declined to settle and insisted on taking their cases to trial because they wanted public accountability. Olivia's story published in a national healthcare policy journal and got picked up by major news outlets. She'd interviewed multiple patients who'd been harmed, connected the pattern across multiple states, and traced the opioid recruitment methodology to online forums where unethical medical professionals shared tactics. The story created enough pressure that federal prosecutors announced they were expanding their investigation to look for similar schemes at other facilities nationwide. I got calls from attorneys representing patients I'd never met at centers in California, Oregon, and Nevada, asking if I'd consult on their cases. Carolyn warned me to be careful about overextending because every consultation created more potential for me to be called as an expert witness in depositions and trials. Kevin Archer was one of the patients who insisted on going to trial. He'd been a marathon runner before his knee surgery. The procedure went well, and he'd been recovering normally at Riverside until his pain suddenly spiked. Warren had been his treating nurse practitioner and had personally managed his medication adjustments. Kevin ended up on increasingly strong opioid prescriptions and eventually developed a full dependency. He lost his job because of his addiction. His marriage fell apart. He spent 6 months in rehab getting clean. Kevin gave a victim impact statement during Warren's sentencing hearing that destroyed everyone in the courtroom. He described training for marathons, the injury that required surgery, the hope he'd felt during initial recovery at Riverside, then the sudden pain increase that made no sense, the prescriptions that kept getting stronger, the point where he realized he wasn't taking pills for pain anymore but because he couldn't function without them. He talked about his wife leaving with their daughter, about losing his construction business, about waking up in rehab realizing a medical professional had deliberately done this to him for profit. He looked directly at Warren while speaking and asked how it felt to deliberately create addicts for profit. Warren stared at the table and said nothing. The judge sentenced Warren to 8 years in federal prison on charges including healthcare fraud, conspiracy to distribute controlled substances, and assault. The pharmacy owner got 12 years. 2 pharmacy employees got 5 years each. Dr. Hartley was charged with healthcare fraud and obstruction of justice, but her trial was delayed multiple times while her expensive legal team filed motion after motion. The prosecution's case against her relied on proving she knew about the medication tampering, which was difficult to establish definitively. Her defense argued she was a busy administrator who trusted her staff and couldn't be expected to personally review every medication entry. The paper trail showed she'd been warned about irregularities but didn't show explicit knowledge of the opioid scheme. I testified in a pretrial hearing about her silencing my concerns and threatening my career, but her lawyers argued I was a disgruntled employee with a grudge. The retaliation case Carolyn filed on my behalf settled out of court after 14 months. The center's insurance company paid me an amount I'm not allowed to disclose, but it was enough to cover the year I'd been unemployed and provide some financial cushion while I rebuilt my career. More importantly, the settlement included a provision that Dr. Hartley could not contest my statements about her management practices and had to provide a neutral employment reference. Finding a new job took 8 months longer than I'd expected. Physical therapy is a small professional community, and everyone knew who I was. Some facilities told me directly they couldn't hire someone with my history of litigation because it created liability concerns. Others just never called back after interviews despite my qualifications being exactly what they claimed to need. I eventually got hired at a hospital-based rehabilitation program where the director told me she specifically wanted someone who demonstrated commitment to patient welfare over institutional loyalty. She said hospitals needed more therapists willing to speak up rather than protect administrators. The job paid less than Riverside had, but I was grateful to be working again. Caleb never worked as a physical therapist again. He told me over coffee 6 months after the center closed that he couldn't get past the guilt of knowing something was wrong and not acting sooner. He'd gone back to school for an MBA and was working in medical device sales. He said every time he tried to treat a patient during his job search, he'd think about the people whose regressions he'd noticed and dismissed. The weight of that knowledge made it impossible to continue in the profession. Dr. Hartley's trial finally happened 22 months after Warren's arrest. I spent 2 days on the witness stand being cross-examined by her defense team. They portrayed me as someone who'd misinterpreted normal administrative oversight as threatening behavior, who'd jumped to conclusions about billing irregularities without understanding the complexities of physical therapy revenue cycles, and who'd damaged innocent people's reputations out of misplaced zeal. The prosecution countered with testimony from Yasmin and 2 other staff members who described Dr. Hartley's pattern of silencing concerns and prioritizing revenue over patient welfare. The jury deliberated for 3 days before returning a guilty verdict on the fraud charges, but acquitting her on obstruction. She received a 4-year prison sentence and permanent loss of her medical licenses. Her appeal is still pending, but legal experts tell me it's unlikely to succeed given the evidence presented at trial. The FBI's expanded investigation found similar schemes operating in 11 physical therapy centers across 6 states. 7 more medical professionals were indicted on related charges. The patterns were eerily consistent. Medication tampering to slow recovery and extend treatment duration, billing irregularities to maximize insurance payments, and referral networks to pharmacies involved in illegal prescription distribution. The total patient count exceeded 200 people who'd been deliberately harmed by providers they trusted. Federal healthcare fraud regulations were updated to require more stringent oversight of physical therapy billing practices and medication documentation. Professional licensing boards implemented new continuing education requirements focused on recognizing and reporting fraud. The reforms came too late for the people who'd already been victimized, but hopefully they'd prevent future schemes from operating with the same ease and longevity. I still work at the hospital rehabilitation program where I was hired 3 years ago. I was promoted to clinical supervisor with responsibilities, including protocol oversight and staff training. I take that responsibility seriously because I know firsthand how easy it is for harmful practices to become normalized when no one with authority is paying attention. I've implemented anonymous reporting mechanisms for staff and regular patient satisfaction surveys that specifically ask about medication instructions and billing concerns. When new therapists join our team, I tell them a version of my story as part of their orientation. I want them to know that speaking up when something seems wrong is not only allowed but expected, and that will support them rather than silence them. I testified before a state legislative committee supporting stronger whistleblower protections for healthcare workers. I shared my experience of being placed on administrative leave and threatened with termination for reporting patient harm, and explained how many healthcare workers stay silent because they can't afford the personal cost of speaking up. The legislation passed with bipartisan support and included provisions for financial assistance to whistleblowers during investigation periods and stronger penalties for retaliatory termination. Some of the patients I treated at Riverside have reached out over the years to thank me for exposing what was happening. Milo Fuller invited me to his daughter's high school graduation and introduced me to his family as the person who helped get his life back. His shoulder had fully recovered after he'd gotten proper care elsewhere, and he'd been pain medication-free for 2 years. I've become an advocate for patients navigating physical therapy and pain management consulting with patient advocacy organizations and speaking at medical ethics conferences about recognizing red flags in treatment settings. I teach patients to track their own recovery progress, compare their treatment plans with their surgeon's original orders, and question anything that doesn't make sense rather than deferring completely to provider authority. The medical system requires a power dynamic where patients trust their provider's expertise, but that trust becomes dangerous when providers abuse it. Those handwritten notes I found in Warren's file proved this wasn't negligence or incompetence. He'd systematically targeted vulnerable people recovering from surgery and deliberately sabotaged their healing to create opioid dependency. The pharmacy network exploited that dependency for profit. Dr. Hartley knew enough to stop it and chose revenue over safety. 40 patients went through extended pain and treatment they didn't need. Some developed addictions that destroyed their lives. The legal system gave them financial compensation and sent people to prison, but it couldn't give them back the years lost to addiction or repair the damage done when medical professionals weaponized their trust. Warren is in federal prison. Dr. Hartley lost her medical license. Regulations changed. Patients got compensation and justice, but the scars remain for everyone involved. If you enjoyed this, you'll definitely want to see the next ones too. So subscribe now and let me know your take in the comments.